Um, our theme this week is about sugar. If you guys saw some of the posts that we did on Instagram, and how sugar is affecting the oral cavity. Obviously, we all know that sugar's in everything, whether it's we're getting our processed foods packed with this, these really horrible sugars, uh, or obviously we're getting in our juices, and that's not great either. Obviously, the ideal place we want to get our sugars is our fruits and vegetables. So we're talking about the bad sugar here. When I say sugar, we're not talking about having an apple or even a banana. But now, what I want to share with you guys right now is, what happens in the body, but more specifically in the mouth when we're having these processed sugars, and the havoc it actually causes. And it's to talk a little bit about sugar itself. Obviously, I call it a drug because it's in my mind addictive, and mind altering. So and pretty much it's used to sell a lot of products. It's put in everything, and these processed cane sugars and corn sugars and cornstarch and sucrose and all these things that are, if you really look in on labels, you'll find. And what it's doing is pretty pretty crazy, and a lot of times not seen. Most people focus on maybe the weight gain or calories, uh, and there's more to it than that, and people that are wanting to, for the New Year's, lose a little pound, a few pounds, they're going to, well, I'm going to cut sugar, and that's fine because, it does have a huge effect on your overall systemic health and the overall, adding those calories in. I know when I'm having sugar, I immediately see a change in my body, and it not only in your body just reacting as far as inflammation goes, but the calorie intake it adds up, right? And you see the effects in your body right away. But I wanted to focus on the mouth. So obviously, um, there's things that happen with sugar, that in the mouth we there's staining that happens, and but number one effect on the oral cavity is on the balance on that microflora that's in your mouth, the bacteria, the good bacteria and the bad bacteria. And sometimes I've seen an analogy of the cops and robbers, the good bacteria being the police and the bad bacteria being the robbers, and having the right balance there is great. Your body's under control. The good cops are keeping the bad bacteria at bay. But what happens when you're having sugar? Think of it as food for your bad bacteria. And when you're having this uh, constant onslaught of sugar in the form of processed sugars and carbohydrates and such, these bad bacteria, they feed on it and produce acids. And these acids cause havoc in the body. As we all know, we always are trying to keep a balance between the acid and basic balance of your blood. We want to have alkalinity as opposed to acidity. So you're trying to improve your overall health by being more alkaline. So there's alkaline water, green juicing, all these things produce less acidity and counteracted with alkalinity. So in your mouth, what causes cavities is the acidity, which is the byproduct of these bad bacteria. So when you're having these sugars, this throws this balance off, and now we get an influx or increase of bad bacteria. So with this bad bacteria, what happens? Well, number one, you get cavities. So now you are getting cavities where you're brushing your teeth, you're flossing. Patients come and say, you know what, I'm brushing and flossing my teeth every day. How come I'm still getting cavities? And, the kids, getting cavities. I don't know. I brush your teeth and floss your teeth every day. Well, you got to look at what you're putting in your body. What is it that you're putting in your body on a daily basis? Because what you're putting in is what you're getting out. And so it's not always, necessarily, gut fat, or you're getting love handles. Maybe you have a fast metabolism, but what it is still disturbing is your oral bacteria, and you get cavities, even if you're flossing and you're brushing, because that acidic environment causes the cavities. Now, besides that, and sometimes even more important than the cavities, is it actually promotes plaque and bacteria inside the mouth. The plaque, that film that's on your teeth, this plaque actually contributes to cavities, but also it causes gum inflammation. And this gum inflammation, it leads to gum disease. So now gum disease is a bigger problem than cavities, because cavities, it's a local tooth problem. You get a cavity. Obviously, we don't want them, but we got to clean them out and fix the tooth as far as a filling goes, or a crown, or some kind of treatment to stop the progression of a cavity that could lead to a tooth loss. Now, that's bad. We don't want to lose our teeth or get tooth infections, or, you just want to keep everything as your own and your own natural teeth. But when you have gum disease, it's a whole nother ballpark. So gum disease is more of a systemic problem than really a tooth problem, because when you have gum disease in your mouth, not only is it a situation where the bacteria are causing inflammation in your mouth and the gums are red or bleeding, but also it causes bone loss, and the bone around your teeth start going away. I don't need to tell you, you don't need to be a dentist, your teeth are going to get loose and your teeth fall out. Now, obviously, that kind of it could be not good for your daily life to lose your teeth, but what's on a deeper level, there's a much bigger problem happening than just losing your teeth, which is horrible. But bacteria going into your bloodstream related to the gum disease is now causing a lot of other health issues. So these bacteria that are not supposed to be in your blood, that are from gum disease, go into your heart and go to other your joints, and are causing other health issues, like even cancers, and, like I said, heart disease, and in other inflammatory issues throughout the body. And this inflammation, for example, that we see in the body, now these inflammatory markers are going everywhere, causing inflammation, and inflammation being one of the bases of disorder and disease. So when we are having these fun sugar candies, or fun treats, or fun snacks, there is a slew of cascading events that happen in the body. And you might see the results of it in the mouth when you go to the dentist with a cavity, or them telling you your gums are bleeding or cavities, and you're like, but I'm doing everything I'm supposed to be doing. But a lot of times, as holistic dentists, are focusing on health and nutrition, because when you're what you're putting in your body, and being conscious of what you're eating actually, and your nutrition, has so much to do with your overall health, yes, but actually also your oral health. And your specific oral health balance in that microflora will produce not only less cavities, or less chance of having cavities, but also less gum disease, and overall oral health, which now research has shown this: when you have that really good oral bacteria balance, that actually cascades into the body, and that entry point of good bacteria cascades into your, not only your bloodstream, but also your gut. So you get that really important gut bacteria that we're all more focused on. It will improve when you have good oral bacteria and that good balance. Your gut bacteria improves, and then the bacteria in your skin, that actually will improve as well. And other areas that we have good bacteria. And there's a few other areas that are really important flora of good bacteria that actually help our overall health. So the next time you're, thinking of cheating a little bit or having fun and just, having those processed carbs and processed sugars, think twice and think about what effect that's going to be having on not just your oral cavity and oral health, but also your overall health, because it is important and it makes a big impact. And these are things that it's hard, a lot of times hard to come back from. And, the damage is done, and it's sometimes hard to recover. So if this is helpful, please comment below or let us know.